This is me, Craig Ferguson. I'm inviting you to come and see my brand new comedy hour. Well, it's about an hour and a half, and I don't have an opener because these guys cost money. But what I'm saying is I'll be on stage for a while. Anyway, come and see me live on the Pants on Fire tour in your region. Tickets are on sale now, and we'll be adding more as the tour continues throughout 2025 and beyond. For a full list of dates, go to thecraigfergusonshow.com. See you on the road, my dears. My name is Craig Ferguson. The name of this podcast is Joy. I talk to interesting people about what brings them happiness. Today in the podcast, one of my favorite guests of all time, of all the shows I've done, a terrific man. I'm very interested, and if you're interested in your health or general health, and I think most people are, but maybe you're not. But this guy is I just can't get enough of him. His name is Dr. Well, I spelled his name, but that's his title. He's Dr. Robert Cerfolio. Enjoy. So listen, here's the thing, Sheriff. You are a record breaker today because you are the first time I've had. Is this the third time you've been on the show?
Third time. It's a big honor for me. I'm honored.
And listen, and let me just say this. The third time on the show, but remember the first time we recorded, it didn't record at all? So
How could I
technically the fourth time.
The fourth time. That's exactly right. Yeah,
now, what's the deal with your headset? Are you doing a lot of robotics?
No, it's like I'm an
stuff?
air traffic controller, and I wanted to get a drink of my water, but I don't want to get water on the thing.
Hey, I'm just going. You made me think I want to drink water. So, what's the deal with when you do the thoracic surgery? Do you do it
thoracic?
Thoracic, like Thoracic Park?
Exactly. Instead of Jurassic, it's thoracic. You're right. But I love that analogy. You're right on it, man.
So let me ask you this: do you wear your little headset when you're doing it and tell everybody what you're doing?
So when I have visitors that are remote, I do. And it's awkward when I scrub in. You have a headlight, magnifying glasses, and this. Then when I go to the that should put the ports in and make the incisions. Then when you leave the patient and you walk 10 or 15 feet over and sit at the Da Vinci console where you're looking through the box and moving your hands, then I just have this thing on. But it's more comfortable than the one that they gave me today.
Talk to me about what's the Da Vinci console, because I think I of course know what it is, but many people will not know what the Da Vinci console is.
You're 100% right. I mean, people still don't get it. So when we say we do robotic surgery, what that means is first we're scrubbed in like doctors with gloves and a mask, standing over the patient. We make 3 or 4 little incisions, put tiny instruments in like through a little probe, and then the instruments go inside of that, and then there's this giant contraption that rolls over the patient and gets attached to those arms. That's the robot. But we don't operate that from the operating room table. We then leave the table. We take our gown off, our gloves off. We go sit in the chair and we look in this giant box. So we're sitting looking in this monitor, this immersive world. And what I love about it, actually, I was giving a lecture last night and they say, where am I happiest? I said, I'm happiest, in a very competitive pickleball match or a great golf match when I'm doing well, or teaching or educating or putting an impact on the world, or when I'm submerged underwater, scuba diving in the robotic console. Because what it's like is you become miniaturized and they drop you inside the chest, in my case, or the belly if you're a belly surgeon. So I'm now looking in this console. My head is in this thing, 3D. I'm looking through this glasses. I can move my hands. I can move my feet. There's 6 pedals for my feet. There's a couple pedals for my hands. And as I move, those instruments that we put in through those little tiny sticks, they move and they are a mimic to our hand motion. So the surgeon's doing the operation, not the robot. But the robot allows you to shrink your hands down to these tiny little 1 centimeter or 1/2 inch instruments instead of your big ugly mitts in there where you're making big incisions and spreading the ribs or cutting the muscle. So it's minimally invasive. So that's how it works.
That's amazing to me, because I don't know if you remember when you were a kid. You and I are the same age. You remember a movie called Fantastic Voyage with Raquel Welch in it?
How can you forget Raquel Welch in that outfit? My God.
Right. So Raquel Welch in Fantastic Voyage, where they
there's a robot, a scientist or something like that, and they have to shrink themselves down into a little spaceship, and then they go into the guy's bloodstream and they sort it out.
It's exactly what it's like. But they, of course, are really small, and they're just inside. Remember, the way they got out was through the lymphatic system. Remember, there was the arteries in Venus, and they went in the lymphatic.
See, I think that was a script there. They should have come out the pooper. I feel like get into the digestive tract, get your little spaceship. Look, there's been times when I felt like I've had a spaceship in my digestive tract, and you get into the intestine and out you come. And on the way out, quick colonoscopy.
Not to mention, and then it's very appropriate that they end up in the excrement, giving how the ending of that movie went. But yeah, you're exactly. The problem with that is, of course, if they get in any type of the GI tract, they create a hole that they have to seal on their way in. So that was one of the problems. That's why they went through the ear, if you remember. But what a fantastic movie. Yeah, what a fantastic movie.
I didn't know that it was so accurate. Do you ever, I met Raquel Welch a couple of times. She was on my old late night show.
Really?
Yeah. Now, for you and I, our generation, to get to meet Raquel Welch. So, but here it gets even better. So she knew I was very excited to meet her. So the crew at my show, they got a giant poster of, the poster of her wearing the fur bikini in A Million Years BC. I was going to
say it was in the fur bikini. And what movie was that? It was
1 Million Years BC.
That was it.
Yeah. So she's in the fur bikini, and she wrote on it, and she said, "Cher Craig," because she liked to speak French. She said, "Cher Craig." I remember because I've still got the poster. "Cher Craig, you can visit my cave anytime." Please remember to wear your kilt. Love, Raquel.
Oh my gosh, that would be like
God bless
a dream.
Her. She was amazing.
She was. Everybody had a poster of her when I was a kid. She was unbelievable.
Yeah, that was the
how
girl.
Is she still alive? And how old is she now?
Sadly she passed a year or two ago.
She did.
I think she got. I don't know for sure, but I think she had trouble with Alzheimer's or dementia or something. It was. I don't really know the difference, to be honest. Well, maybe you could tell me, what is the difference between Alzheimer's and dementia?
Well, there's a pretty big difference, actually. I mean, Alzheimer's is one type of dementia. Dementia is a more general term, of which there's specific types. Yeah.
All right. So dementia is like a blanket term, like cancer, maybe like cancer. There's so many different cancers,
correct.
But it's a type of cancer.
Yeah, it's kind of like dementia, where you and I are headed. That's a general term that we could apply.
I don't know why you have to say that, because it's not necessarily going to that.
It's not.
Somebody asked me once, a buddy of mine asked me once, he said, when you get older, what do you want to go? The plumbing or the upstairs? And I'm like, oh, definitely upstairs.
You do?
Well, no. I think upstairs, because then if my upstairs goes, that's somebody else's problem. If the plumbing goes, that's my problem. That's me got the problem.
So it's interesting because I think it's somebody else's problem. The last thing I want to do is do that to my three boys. Remember, my three boys lost their mom. The last thing I want to do is go through a hard thing with me. So I'm like, listen, if that happens, we go on a cruise, and I just happen to slip off that top part of the little outdoor thing, and I'm gone, and don't tell anybody for like the next day, and then don't worry about it.
No,
because I think that's terrible.
My deal I have with my wife is that you get me into some kind of situation where I'm on a drip, like some kind of Percocet propofol drip, and just hit that thing every hour on the hour and put movies on.
Yeah, the only problem with that is there's a medical record that leads to that could get her in trouble. I think the cruise is much safer for you and your family.
Yeah, I guess. Yeah. Well, look, see, here's the thing. Now, I go for my annual physical yesterday. So it's kind of, but you know what? It's 2 years since I had a physical, but.
Well, you're so healthy. That's all you need, man. Look at you. You look like you're 45 years old. You look great. You look even healthier this time than I think the last. Maybe because we're not together, but you look great.
No, I tell you what it is, my friend. I lost weight.
I knew it. I could tell. I bet you lost about 20 pounds, right?
I don't know if it's as much as that, but it's a lot. I mean, what I did was I recorded a stand-up special. And then I go into the edit for the stand-up special, like, who the fuck is that guy?
Yeah.
I was like, oh my God. I know, because the special is out now, and people are like, oh my God, he looks so fat. And I got fat. I I just stopped exercising, and I just kind of like wasn't paying attention to the food, and boom, because it happens much quicker now, that kind of thing, now that I'm older.
No,
so I
no
had
question.
to I'm back on it. I'm walking and running every day. I'm doing calisthenics. I'm like trying to lay off the candy and stuff, but it's much harder than it used to be to get in shape. Have you noticed
because
that?
we're 60. Yeah, because we're 60. That's why I'm so, I don't even have a glass of wine at dinner anymore. The last year, I'm like, I don't need it. I sleep better without it. And I don't need the calories because it affects my sleep. And I can notice that I'm up a pound or two because I weigh myself twice a day because I'm crazy. But I think you're right. It's part of being 60, and so I'm totally into the health thing. I'm a nut about exercising and all that. It's fun.
I know you are.
But
it shows. Look at you. You're in fantastic shape.
I appreciate that.
Now, let me just say this. So I go for my annual physical, and I'm talking to the doctor. It's a new doctor because I moved back to New York, so I get a new doctor, and me.
We're happy to have you back in the city which is your home, where we love you. So thank you for coming back.
Thank you. It's the greatest city in the world, and anybody that doesn't agree with me can, they don't need to come here. So
I agree.
So I'm talking to my doctor. Now, I like a doctor, especially for a general practitioner. I like a big city doctor with slim fingers. You know what I'm saying? So I'm talking to him about that, and he said, the prostate exam, said that's going to go away soon. That's going to go away. Yeah.
You can just say you don't want it. Just get a digital rectal ultrasound or a PSA or an MRI of the prostate and say, the last 2 times I said, listen, I don't want a digital rectal exam. I'm out. You're not doing it. You can do that.
Well, I don't know about you, man. I'll miss it.
I don't. Of course not. I mean,
no, man. I'm like, for me, it's a bit like vinyl. You know what I mean? It's like it's not necessary anymore, but you kind of like the quality.
It's had its day. I tell you a quick story. So when you're a medical student, you have to pair off with another a male student. Of course, the men if there was female medical students, they had to do it to the man, obviously. And,
really?
And the vice.
Because there's no prostate up there.
Yeah, exactly. Right. So, to make a long story short, when I went into the room with the other guy, I said, listen, I'm just going to skip it. If you agreed to skipping it, I'll skip mine. If you skip yours, he said, yes. So we did. So I never had one. So about 5 years ago, I had to get this executive physical, and I go see a doctor here in New York where I work. And he goes, you need a digital rectal. I said, listen, bro, I've never had one. He says, well, then you're overdue. And I said, no, you can do an MRI and you can do a PSA of the blood, and I'll take it. And he said, and you need a digital rectal exam as well. He was so insistent. And then he said, you're not listening. You're being a typical doctor who's a bad patient. I said, okay, fine. So I've had one in my lifetime, and that will be the last one.
Yeah, well, I don't know. I mean, look, as things that can happen to you in the doctor's office, the digital rectal exam, it's kind of like a night out in the 80s as far as I'm concerned. It's no big deal. But
I've never heard it expressed that way, Craig, but I love it. I may use that line in my lecture tomorrow.
I mean, we all live differently in those. Well, I live differently in those times. But let me ask you this then: if you're doing an MRI of
the prostate.
Of the prostate, isn't that got radiation in it? Oh, isn't that
no? MRIs have no radiation. That's the advantage to MRIs. No radiation, and a CAT scan that has some radiation. Like I've flown to the Bahamas the last couple of weekends. I got probably more radiation on that flight, 3.5-hour flight there and back, than I do getting a CAT scan without contrast or a chest X-ray. So yes, there's chest X-rays and there's CAT scans, and there's CAT scans with contrast, and there's a PET scan that has a lot more radiation, but the amount of radiation is negligible. And when patients ask those questions, we say, we're doing this to either you have cancer and we're following you or surveying you, or we're working you up for cancer. That's a much higher risk to your life than the minuscule amount of radiation that you're getting from the scan. Yeah. So don't worry about that.
So let me ask you this then, because I got a new doctor, so I got to run all this. You're my second opinion guy, right? You're my go-to guy, right? Okay.
And my price is right for the second opinion.
I was going to say, I wish I hadn't said that, because now I know I owe you a lot of money.
You're paying me what I'm worth, so it's appropriate.
So I it's not really a second opinion, but he said to me, look, we're going to look at your cholesterol and do as a whole new blood panel. He said, but you're in your early 60s, so I want to do a calcium, was it a calcium
scoring study, and I was going to suggest that you get one. You should get one of your heart to look at calcium in the epicardium, the outside of your heart, to make sure you don't have coronary artery disease, as opposed to getting a cath, where they stick a catheter in your groin or your wrist and they put a catheter up and then they inject contrast and they look at your arteries.
I really would not. I'd prefer not to have that. That sounds like...
That's not a big deal, but that's a little bit invasive. It's a little nick in your artery, but you're right. You don't want it. And the calcium scoring study, hopefully yours was 0.
I don't know yet. I haven't had it yet.
Oh, yeah. I had mine 6 months ago. It was 0, which was good. But,
when does it get to be a problem? If you have, what do they do if they find calcium on the outside of your heart? Is there drugs for it and stuff?
Yeah, typical doctor, we always give an answer. It depends. I mean, it depends on your family history. If you're overweight, if you have hypertension, all these other, if you're symptomatic, do you get chest pain? If you do, then you're going to get a cath. I mean, you're going to buy a cath if that happens. If you're asymptomatic and don't have any risk factors and it's 50, you're probably okay. But if the score is 1,000 or 2,000 or something, then you're going to get a cardiac cath, which is what I just described a minute ago.
What is a cardiac cath?
So cardiac, they used to put it in the groin and put a catheter up. Now we do them in the wrist, and we put a little tiny catheter up the artery, and it goes retrograde, opposite of how the blood flow goes, right down to your aorta, and right off the very proximal part of the aorta are 2 little orifices, 2 little openings that carry your right and left coronary artery, assuming you don't have congenital heart disease, and a lot of people do and don't know it, but let's say you're normal, and they put a little catheter in that, and they shoot contrast, and then it shows all of the arteries. The left-sided artery that has a couple of the big branches, one's called the LAD, one's called the obtuse marginal, et cetera, and these other branches. And then on the right side, you have a right coronary artery that usually supplies your sinus, the sinus node, which runs the rhythm of your heart. So they look at the left and the right arteries of the heart and make sure that there aren't blockages that are 70% or greater. If they're 70% or greater, then you might need either a stent, which they can do right through this little incision, or if you have 2 or 3 arteries that are blocked, then you need a bypass operation, which is what, I'm a cardiothoracic surgeon. I do the thoracic part. My partners do the cardiac part, but that's what we do in this department every day.
Man, that sounds like now I wasn't really bothered about it, but now I'm kind of scared about it a little bit.
No, don't be, because this is a screening study, and chances are high that you've lost weight, you're exercising, you have no pain with exercise. So chances are, and you have no family history of heart disease in your family, do you?
No. So nobody lives long enough in my family to get a heart attack.
They're too busy drinking, right?
Yeah. They die of alcohol or food-related cancers before they have a chance to have a heart attack.
Fork and hand-related disease, I call it. Fork and hand. The hand and the fork.
But that's interesting, because I was talking about, because my dad, I know I talked to him, my dad got esophageal cancer. And
I know that's one of the things I operate on.
Right. That's so I was talking to my doctor about it, and I said, what do you think? And he's, because what happened was, I remember I told you this, I was getting, pretty intense indigestion, like heartburn and stuff.
Yeah.
And I had it screened, and they found esophagitis, no Barrett's, but some kind of esophagitis and some kind of inflammation. And I went on those Prevacid things, the omeprazole or something like that.
Omeprazole.
Yeah.
It's great.
I went on it. I went on it for about, I think it was 7 or 8 months I was on it. And then I got a second screening, and it had all gone away, but I still got reflux. So what I started to do is that's when I really changed. I dropped the weight and stuff like that. And I think it's the weight, man. I think it's
100% the weight, and I'm sure he told you that. So the omeprazole just reduces the acid production, but if you lose weight, you'll have much less reflux for sure. So that's great.
That's amazing to me, because I put on weight, but I wasn't nobody was going, hey, who's that fat guy? Said me, but you don't need to have that much, apparently.
No, you can just gain 10 or 15 pounds and all of a sudden start to reflux. And as we get older, you're more likely to reflux. And here's the important thing for your listeners, and I'm sure they're not listening for medical advice, but if they are, 30 or 40% of people who reflux are asymptomatic, meaning they think they have sleep apnea, or they don't sleep well, or they have stenosis of their windpipe, and it's because they're refluxing and they don't know it. So it's one of the things that we look for when people have these other symptomatologies. They get recurrent pneumonias, and we don't know why. Well, at night they lie flat. Food comes up, it goes down the wrong pipe into the lung, usually in the right lower lobe because of the structure of the anatomy of the bronchus, and they get right lower lobe pneumonias. And as they've been refluxing and aspirating at night when they sleep, or a lot of people, sleep apnea is related to reflux and they don't know it. They wake up because there's a little bit of acid in the back of their mouth.
That's so weird to me, because I kind of like for something I'm very kind of sensitive to it because of my father and his story. But
sure,
the fact that people can be experiencing that and not even know because they think it's something else. I mean, it's like, that thing, I'm sure you know this, Hippocrates,
yes,
who said,
I heard of him.
Let food be thy medicine, is what he said. That was one of his things. Let food be thy medicine.
And I love your historical wisdom. You have all this wisdom from history. You're a history buff.
I am a history buff. I know. I do like the ancient Greeks. I have to say, I'm interested in them. But I tell you what, they didn't have. They didn't have antibiotics.
No, they didn't have that. And they didn't have morphine.
Yeah.
They didn't have that.
Do you know what, though? I heard this thing about ancient Egyptians. One of the few, how they used to wear the black eye makeup, right?
Yes.
It's because of the sand, right?
Right.
And what, like football players, but also what they had in ancient Egypt is that they had severe dental pain.
Yes.
Because sand gets everywhere, and it got in the bread, and the bread would grind down the thing. So that's what opened up the trade route, the opium route from China to ancient Egypt, because opium was the new wonder drug. It was coming in from in Afghanistan, which now Afghanistan, but I guess it was something else then. Asia Minor and all that stuff. And that's how these trades started out, because the Egyptians would buy as much opium as they could get.
Of course.
Because of the dental pain. So what I'm saying is...
Well, and of course, they didn't take care of their teeth. They didn't really understand, the importance of it or have the skill. It probably had a lack of fluoride. We don't want to talk about fluoride with all the political controversy of fluoride right now, but they didn't have that when they were younger, which was clearly needed, et cetera. Yeah, and, dental infections led to a lot of heart disease in those days. And, as a heart-lung surgeon, there's a thing called endocarditis, which is infection on your heart valve, often from infections in your teeth. Bad dental care.
That's why I heard that the plaque in your arteries is just the same plaque as like plaque on your teeth, right? It's the same shit.
Well, that's a little different, but it's a little bit different. But I think it does similar damage. Let's put it that way.
Yeah, I mean, it's funny that because when I grew, famously, I think it's better now, but the UK was bad. Scotland, in particular, when I was a kid, was bad for dental care. Just bad.
Terrible.
And they have this huge, problem with heart and lung problems. They used to. I think that was smoking.
It's gotten better. And the dental care has gotten much better, for sure.
Yeah. But there was, I don't think it was Hippocrates who said this, but I have heard this phrase, death enters the body through the mouth or the anus. That's how it gets in.
Wait, who the hell said that?
I don't know, but maybe I said it.
Maybe the mouth I can see, but the anus.
Well, what about the rise in colon cancers with the young people? But
that doesn't come from the anus. That comes from the colon. Comes from epithelial changes inside the lining of the colon. It's not coming from the ass going up. That's starting off.
Well, you say that, but it could be rising damp. Do you know what I mean? It could be like, But let's talk a little bit about that, because what is the do you have any kind of opinion or take on this, or is it even true that there is a huge rise in gastrointestinal cancers in young people, colon cancer in particular, I think?
Yeah, so we got to be a little bit careful about incidence and discovery. So, what I mean by that is now we're doing a lot more colonoscopies on people we would never do before. We're doing more CAT scans, and we're discovering things in asymptomatic patients, and much more asymptomatic patients are getting screened. And we're also much better identifying a genetic group of patients who are predisposed to this because of either they have an autosomal dominant or some sort of genetic disorder or a family history that puts them at risk. And so we're finding more of it. So does that mean that there's a greater incidence in the population, or we're just better at discovering it now? So I think it's probably multifactorial.
All right. So better column A, better column B, right? I mean,
correct.
Everybody talks, particularly cancers, we talk about early detection, right?
Yes, and it makes a huge difference, enormous difference as a surgeon.
It really does,
night and day. I mean, look at lung cancer. 20 years ago, you see everybody with stage 3 disease, and 20 or 30% were alive in 5 years. Now, 90% of the people I see are stage 1 disease, and I operate and take the lung cancer out, and 95% are alive at 5 years. The practice is completely shifted in my lifetime.
As a friend of mine actually just had a cancer, and he went through, I don't know exactly which one it was, because he's kind of like, didn't really want to talk about it, but he had an operation to remove the tumor and then went on a course of chemotherapy.
Yeah.
Is the what's that? If you remove the tumor, what's the deal with the chemotherapy?
So it depends, and it would be nice to know the specific cancer. So I'll just talk about lung cancer. So the majority of our lung cancer patients don't get chemo because we see them in stage 1. But if they're stage 2 or 3, they get chemo first, which we call neoadjuvant, neo before. So they do neoadjuvant chemo, then we do surgery, and then they often get chemo afterwards. But to make a very long, complicated answer very short, if the tumor is over a certain size, it's a predictor there could be microscopic cells in the blood, even if we don't see it, even if the PET scan and CAT scan says, hey, liver's clean, brain's clean, everything looks great. We sometimes give chemo, or if it's in a lymph node. So if it goes to one of the lymph nodes that we as surgeons remove routinely and make sure the patients out there, if they're getting lung cancer surgery, they go to a real surgeon who takes out nodes. We take out 20, 30, sometimes 40 lymph nodes. If the lymph nodes just have one lymph node as cancer out of 40, that's an indication to get chemo, because it means there could be circulating tumor cells in the blood, and chemo just goes in the blood and circulates, and the idea is to kill it. But of course, it kills your normal cells too. That's why you lose your hair.
Now, does that still happen? Because he was talking about they got some kind of cold hat thing or something.
Yeah,
what does
they
do?
There's cold hat. It was just supposed to help the follicles resist the cellular death from the chemo, and it does work. So, yeah, but in general, people still lose their hair. Their hair thins. It depends, even if they're wearing the cold cap all the time.
Yeah, I don't know. I mean, I think I may just wear the cold cap even if I'm not getting chemo, just in case. You know what I'm saying? It's like,
well, I mean, I think in your case, it'd be a nice story to explain to people why the hell you're doing it. And then you got those beautiful locks, and you got that nice, I've always wanted I've had so many patients come to me and like, you're the doctor I flew in to see you. I said, I got a lot of gray hair. You got to look. But they want surgeons with gray hair. So I'm freaking jealous of that. That looks great.
Yeah, you gotta have the gray hair. That's what I want. I want my doctor to look like the first
like you.
George,
like you.
Yeah, like me. Yeah. But I don't want him to be like me though. Yeah, I don't want to.
I get it. That's
well, you see, the thing is, though, I've noticed this about doctors over the years. Because when you were a kid, I hardly ever saw a doctor when I was a kid. You'd see a doctor. You see a doctor when you break a leg or something. Who cares?
Right,
I mean,
exactly.
But now, when you get to 40, I guess that's when it starts kind of, and all that.
Yeah, well, yeah, you're right. Right.
But
what did the burn and the rantman? Let's just go through each one. The Burntman, what did that refer to?
Well, that's the prostate exam. That begins.
That's what I thought it was.
And this is the colonoscopy.
That's what I thought it was too.
Yeah.
I just wanted to make sure the audience knew exactly the screening modalities that you were articulating so adroitly.
but the thing is, I mean, I was very relieved that when I saw the size of the camera for the colonoscopy, because I was used to working at CBS at the time, and the cameras were pretty bad. I thought, I don't need it.
Now you swallow a capsule with a camera in it.
No, shut up. Is that true?
No, 100%. And then when when the capsule comes out, it can give images all the way through, and then you just defecate it out. So they can get images with capsular cameras.
It really is Fantastic Voyage then. It really is Fantastic Voyage. So you take that, and then you do a poop, and you send the poop to Snappy Snaps, and they...
No, the images get sent, but I guess that's the other way to do it. You could just filter your stool and then just send it into, I guess, the camera studio down CVS. We don't quite do it that way, but that's another way to do it.
Does it transmit it from your body?
Yes.
That's unbelievable. That's insane.
Yeah, that's not new. I don't think that's even new. No, I think that's been around I'm going to say a decade. I might be wrong if any of your listeners want to tell me the truth, but it's not that new.
I had no idea. Well, how come I'm still getting the thing going up then?
Because it's not as good. Because think about it. It doesn't really look in all the, when you put a doctor in the camera, first of all, we clean your colon out so we can see. There's not all that fecal material and fluid, and this doesn't really do this. 2, we move the camera around and get really a much better look at each one and really inspect it much more carefully. But we can't get to the small bowel, right? It's hard to put a scope. A scope can go down your mouth. Then you have like 30 feet of loops of bowel. You can't get through all that with a scope. The colon you can look at. You can put a scope from the anus and go up the rectum, the sigmoid colon, the ascending, the transverse, and the descending, the descending, transverse, and ascending, and get right to what's called the ileocecal valve, and even look at some of the ileum, which is the end of the small bowel. But you can't look at all the duodenum, jejunum, and ileum. They're way too long. So this little camera can look for that in case people are having bleeding, to see if there's little lesions in the small bowel, because you can't scope the entire small bowel. So it has other indications.
So what would you say then, if anyone said to you, like, say someone between the ages of 50 and 70 said, if I can only have one test, one screening, what would be, get this? If you don't get anything else, get this.
For me, it's a very easy answer. It would be a full body CT scan or full body MRI. And I like the CT, but people are moving more towards the MRI. There's no radiation and stuff, but a CT scan of your chest, abdomen, and pelvis gives us so much information. We're not looking at your thighs, your knees, or your ankles, and you could include the brain, but if you're cognitively with it, like I guess you and I would just pass the mark that we're cognitively with it. Like I said, we're just at the borderline, but then you don't get much benefit of doing a brain scan. But a CT scan of neck, chest, abdomen, pelvis does even now. It's not blood work. The blood work also needs to be augmented. But you said one test. I don't know if you'll give me both, but I would pick the CT over the blood work.
So does that? I mean, like that calcium thing I'm getting, that scan I'm getting in my heart, that kind of routine thing. Would that be included in that?
No, that's a very specific thing to look at coronary artery disease. But let me tell you something interesting. So I had clinic on Tuesday, and I told you I had 3 people come from other countries. 2 of the 3 had their lung nodule found in a calcium screening study. They're asymptomatic. They never smoked. These are very wealthy people getting their executive calcium scoring study. And you just look at parts of the lung. You look like the right middle lobe and part of the left upper lobe. And one had a nodule in the middle and one had a nodule in the upper lobe. And they both turned out to be lung cancer. So that screening study for the heart saved their life and got their lung cancer resected. We did their operation yesterday, and they both went home today.
Wow, that fast. So it was a thoracic operation then, right? It was.
I took out part of their lung. They went to see their heart doctor to make sure their heart was good. But that study, which images the heart, blows the heart up, also looks at a small part of the lung and happened to find lung nodules in that small, just in the right middle lobe, and then the left upper lobe, which is when they look at the heart. The heart sits there, and they both got their cancers discovered serendipitously on their calcium screening study of their heart.
That's crazy. That's. You know what though? I mean, knowing all the stuff you have, and I know we've talked quite a bit over the past couple of years. I think I wouldn't sleep a wink at night. I think every time I felt a twinge or a ping.
I sleep like a rock because A, because I ain't that smart to worry. B, because I got a pretty clean conscience. And C, I think if you just work out and eat well. And I got to tell you, our society has it wrong, having these big late dinners. Like you go to Spain or you go to these other countries to eat at 9 or 10. You shouldn't eat after 4 or 5 o'clock. I mean, really, even 3 or 4. You should have a pretty big breakfast, kind of skip lunch, and then have something big at 3 or 4. And then make sure you're going to bed at like 10 o'clock, say, on an empty stomach. So your body is sleeping and not digesting food. But if you do those things, everybody gets aches and pains. I mean, I worked out on Sunday. I played a 2-hour pickleball match, and I worked out for 2 hours. I was sore as hell Sunday night and Monday, but that's not cancer related. So, I mean, I think everyone has aches and pains when they wake up, especially when we get to our age at 62.
62, man. I mean, it's so funny that, first of all, pickleball. I mean, that's the new doctor thing, isn't it?
Singles pickleball is great. I played a young 29-year-old young buck, and I finally beat him. The guy's great, but I took it to him finally. But I was sore. 2 hours of singles pickleball is brutal.
What is pickleball? I don't know anything about pickleball. Is pickleball it's like tennis, but with a tiny little bat or something?
Yeah, it's not a bat exactly, but it's like, think of ping pong. And make it bigger, and think of tennis and make it smaller. So it's like standing on a really big ping pong table, but you're in singles, you're running around. I mean, my heart rate was a median of 152 for I think this in the middle hour of that match, my median heart rate was 152. On other ends, I was about 110. So it's brutal workout. And a lot of people, so caution the people listening, because a lot of older people play doubles. They tear their Achilles, they tear their calf muscles, they get little tears in their legs. You have to stretch and work out, even if you're going to play doubles pickleball, because you're bending and turning and hitting and running a little.
Yeah, it's not for me, man. I don't do that.
I think you would love it.
I work alone. So I do calisthenics on my own. That's run great. And I walk or lift some weights.
So when you run, how far do you run, Craig?
It kind of varies. I usually, like nowadays, because I don't want to screw my knees up, because I run on a treadmill. And if I'm on a treadmill, I'll run anywhere between 5 and 10 miles on a treadmill.
So that must take you an hour. How long does that take?
North of that, sometime. Like 5 miles, in under an hour. But 10 miles, maybe like, I don't know, a bit longer than an hour.
But that's unbelievable. You're able to do that with so, I had both my knees replaced. I think you and I have talked about that before, because I played 3 sports in high school, played college baseball, but really from coaching my kids' basketball teams. But so I run sprints. I don't run long distances. So I give you amazing credit that you're able to run 5 or 10 miles, even on a treadmill. And your knees aren't too sore afterwards?
No, they're not bad. But the thing is, when you were doing all that, playing all those sports at the same age, because we were the same age coming up, I was standing at a bar for 15 years. So my knees are fine.
It's the liver. It's the liver.
But the liver is fucked.
That's so funny.
Yeah.
Actually, your liver is probably almost back to normal now, I'll bet you.
Yeah, it should be. I haven't had a drink in over 33 years. So.
Unbelievable. I mean,
crazy.
Let's drink to that. I mean,
no kidding. I mean,
it's a funny
thing, though. I mean, I stopped drinking when I was 29 years old.
It's incredible. And how many 29-year-olds are tough? How many 29-year-olds have the mental fortitude to do that? Seriously, not many, man.
I think what it was is that I was in a fork in the road. It was either jails, institutions, and death, or stop drinking. And it was a tough decision for a minute.
Yeah, it was close call. It's a close call for every. But there are so many 29-year-olds that lack the self-awareness, or even 35 or 40-year-olds that don't see it, and even a lot of people are very functional at work, but as soon as they come home, they have 1 or 2 or 3 drinks, and that is just not a healthy way to go, man.
Well, it's kind of an interesting. I find myself in the horns of a dilemma a little bit about it because I have 2 kids, and you worry that you're passing on that genetically to those guys, and and what I wonder, I think. Look, I'm not a doctor, as we both know, but I wonder if alcoholism is as clear cut as a genetics. I think it's. I think it's a genetic predisposition. I think you
100% right, and we have data that's correct. But without the environment, if I took that person who has 100% chance of being an alcoholic and I put him on an island his whole life with no alcohol, it's not going to happen, right? So it's a mixture between the two. Now, it's funny you talk about the kids because I have 3 boys. And of course, I told them that if you ever smoke, you're going to die 1 puff if you ever drink alcohol. So my middle son, God bless my middle son, Alec, I love him. He doesn't even have a sip ever of alcohol. Never. He's so against it. It's really interesting. How old is your oldest, Craig?
My oldest is 20, just coming up on 24.
24.
But what I said to my kids was, look, you don't have to be an alcoholic for alcohol to fuck up your life.
Exactly right.
You can drink, 5 beers and get in a car and think you're good to drive. And there you are. That's it, fucking done.
You're right.
And
even worse, Craig, is if they don't get hurt, they hurt some little kid or they hurt someone else, and they are screwed up forever with that guilt.
Yeah,
not to mention what they did to the kid in the family.
Right. And what's kind of, I find myself kind of struggling with is because I'm not a temperance advocate. I'm not saying like nobody should drink. I don't believe that. But I kind of, but for me, obviously, it's out of the question. I know, I mean, my oldest boy, he's like, he can just like, he'll have a cocktail at Easter or Christmas or something and go,
it's interesting, isn't it? So, my older son, Robbie, will have, a glass of red wine, which is what I always would do at dinner, maybe once a week, twice a week. I've stopped doing that the last few years, and it's fine. And my youngest son, Matthew, is, they're kind of more normal in that they'll drink a little bit with their friends. And I think that's perfectly normal and healthy and fine. But as you said, there always is a moderation. But my middle son is just completely out on it, Alec, which is really interesting how they get some of this from us and their culture, but of course they see it with their friends. And when they see young women getting drunk, it really turns them off. It's funny. They think it's a really bad look.
I think, I remember once seeing, I was in France in a fancy hotel, and there was an American lady in the bar, and she was a little drunk. She wasn't, I mean, it wasn't bad, but she was a little stroppy, and she was leaving the bar. And I just happened to glance at the way the waiter was looking at her. The utter disgust on his face.
I know.
Because the culture there is not, to be drunk is it's bad. It's a bad look. Yeah. I don't think it was because she was a woman. I think it was because she was drunk. Not because she was a woman and drunk. Just any drunk. It's like,
I think social. I've been to a few social. I gotta be careful how I tell this story to keep everybody anonymous. But a few social events where there's wonderful families, moms and dads and kids that are 15, 16, 12, 20, and then they watch an adult get just completely inebriated. It is just an embarrassing thing for that individual and their family. And then you wonder how's a 12-year-old processing this? The 14 to 15-year-old know exactly what's happening, and probably the 12. But the 7 and 8-year-old, what are they processing, and what do they do with that information as they get older? I think it's impactful.
Yeah, definitely. I mean, I saw that. I saw
Yeah.
drunkenness in adults when I was little. My mother never drank at all, but my father drank a bit, and and the adults around me in Scotland drank. And when you
Yeah.
see them, kind of lose it a bit, it was kind of
Yeah.
scary. But also, I equated it with that must be what a good time is. I
Well,
mean,
exactly. It is part of, hey, let's go out and have fun. You can have fun without alcohol. It's not, the two are not inextricably intertwined. They may be related. And I love when my friends drink and have a good time and get a little tipsy. It's okay, but they're not driving anywhere. They're taking a golf cart to their house usually,
yeah.
and it's okay.
So now young people though, I mean, there's a real rise in, and this is something, because I moved back to New York City, so I notice this a lot, is the amount of weed the people are taking. I mean,
You walk, as soon as you walk out of your building, you just smell it, right? What wafts of it?
yeah, I mean, it's like, it used to be just, pizza, urine, and rat was the smell of New York. Now it's pizza, urine, rat, and weed is the smell of New York.
I was going to put weed first. I was going to put weed over the pizza.
But what I think is kind of weird about it is that, my people, the alcoholics, they still have to walk around they're hiding their alcohol in the bag, but you can smoke a doobie. Like the smoke from the alcohol is not getting up my nose, but
you're exactly right.
I feel like it's discrimination against alcoholics.
I hadn't spun it that way in my mind, but now that you mentioned, I'm on board with that. I'm happy to join, your society with that. Let's go. But I will tell you this. So, I operate in a lot of athletes and a lot of famous people. So I've done several professional athletes. I won't tell you the sport, but you could guess. But the lungs of people who smoke marijuana, and these are world-class athletes smoking it 2, 3, 4 times a day for 12 to 10 to 15 years, the damage it does in their upper lobes is unbelievable. Worse than cigarettes, because before it wasn't regulated. You don't know what the hell was in it. You don't know about the filters and how they're able to function at the level they are as professional athletes is shocking to me. So I have seen an enormous amount of damage from marijuana, and now vaping, of course. So some young kids who vape almost get this allergic reaction. Once a year we have a young child, 17, 18-year-old die because they were vaping. They have some allergic reaction when they get a pulmonary interstitial pneumonitis and some sort of allergic reaction in the whole lung. It's terrible. And then telling families, going out and telling, a 40-year-old mom and dad, and this is their life, that their 15 or 16-year-old has passed away and is now dead from vaping or smoking marijuana. It's terrible. So, we see the terrible end of it. So I'm so anti-marijuana. It's, I can't explain it.
Well, the thing is, as well, with marijuana for me is that, because I get it. I smoked marijuana. I mean, I did all the drugs. And the marijuana, strangely enough, was the one I had the worst time with.
Really? In what way? In what way?
It made me psychotic. I mean, it brought out a panic in me. I mean, I guess maybe speed or acid could compare with it, but I didn't do a ton of speed and acid. But whenever people would casually, I would smoke it when I was about 17, 18. I would smoke marijuana, and it kind of did what it did to everyone else. And then one day, it changed. And whenever I smell weed now, I'm 62 years old. I haven't had a drug in 33 years. I still smell it, and it makes me a little nervous. I'm like,
interesting. I'm going to say, for the record, because your birthday's in May, mine's May 24th. I think yours is May 27th, 6th, right?
No, mine is 17, which means I'm 17. Younger than you.
No. Are you? Is that what that means? Okay.
No, older than you. Sure? Older than you.
Old. I'm going to say, I'm pretty sure. I think you're older, but I was going to let you run with that story.
Yeah.
So, but we both turned 63. We're both born in 1962, right?
That's right.
So I'm going to say, for the record, you're really 63, just to clean the accuracy up there, because Tom's going to have to edit that, and because it's just inaccurate. The truth checker, fact checker in the story. No, it's interesting. Well, so you don't love this. When you smell the marijuana, you don't like it.
No, I don't care for it at all.
Me too. I hate it. It makes me sick. I'm coming out of a beautiful apartment building, jacket and tie, 5:30 in the morning, coming to the hospital to go around, and I smell it on my way to work. I'm like, what the hell is going on here, man?
It's also people smell of it. People have been smoking it think first of all, it's like cats. They can't fucking smell it. You know,
I love when the patients come in and they reek of it, and then they go, "I'm not smoking." I'm like, "Okay, you're not smoking, then I guess your golden retriever must have lit up 6 doobies this morning because you reek of marijuana. It's all over your clothes and you. Oh, that's my partner. Yeah, okay, all right.
Yeah, I don't know. Anyway, look, a couple of old farts like us railing against the rest of the world. It's just a good time, Cerf. I'm always happy to do it. Listen, thank you for making time for us today. I'm always happy to talk to you. More power to you. You are the guy. And if this calcium thing shows up anything, I'll get in touch.
Yeah, just when you're actually just shoot me an email with what the score is. I'm going to say it's a 0. I think you're a 0 guy, and so that's the report we want. And really, a number, 100 or less, or it kind of depends, or 200 or less, we're okay. But let's hope and pray for a 0. You deserve a 0.
I would like a 0. All right, take it easy, man.
All right, buddy. God bless you. Thanks. Bye-bye.
Yeah, you. Bye.
All right, bye.